Hi, I'm Christina, and I'll be discussing and taking a closer look at maternal mortality rate in the US, starting with a recent story published by Vogue. The story put a dire need to make changes in the healthcare system in the spotlight. So, Serena Williams is a 23-time Grand Slam winner and arguably the world's greatest athlete right now. On September 2nd, 2017, she gave birth to her first child. The next day, she left her hospital room to request from a nurse a CT scan and a blood thinning drug due to a feeling that a blood clot had formed. It took multiple requests of both nurses and doctors for Williams to confirm what she had already known. Blood clots had formed due to her being off her anti-clot medication to aid healing after birth. The blood clot wasn't the only complication she had either. Due to coughing fits from the pulmonary embolism, her C-section wound had reopened. During the surgery to correct the clot, her doctors found clotted blood tissue in her abdomen and still had another surgery after that to insert a filter into a vein to prevent further clots from traveling into her lungs. Luckily, her team of healthcare providers were able to treat her in time, but what Serena Williams experienced during the birth of her child is not uncommon with women across the U.S. But what is maternal mortality? Maternal mortality is typically defined as the death of a mother within 48 hours of giving birth. It is usually measured per 100,000 live births. The leading causes of maternal death are currently hemorrhage at top, sepsis, unsafe abortion, eclampsia, and obstructed labor. Hemorrhage is where there is excessive amounts of bleeding, while eclampsia is the onset of seizures during or shortly after pregnancy. At least half of deaths by pregnancy complications can be prevented. As you can see, the United States is right under Turkey in terms of their mortality rate, and it's still high, especially in comparison to countries like itself, which is Spain or Switzerland. In fact, the US has one of the highest maternal mortality rates of developed countries, close to that of developing countries, and it has only progressively worsened over time. In some countries, the maternal mortality rate is so low that it is more likely that the significant other will die during the pregnancy than the person carrying the child. What does maternal mortality look like inside of the US by region? It is a little shocking to see that there's only about 7 states out of 50 that have the lightest shade of pink, meaning they're among that lowest rates of maternal mortality, with New Jersey and Washington, D.C. having the highest rates. The fact of the matter only increasingly gets worse as we look at more specific statistics. According to this graphic, the lowest rate of maternal mortality rate at the bottom is white people, with a classification of other coming in second, while maternal deaths are the highest with black women. So why is this? Why is the US rate so high? Why is it worse with black women? To get a closer look at the problem, we specifically look at black women being disproportionately affected in the US. It's speculated that it could be that high blood pressure, a known factor to cause problems in pregnancy, is typically higher in black women. Another reason is that black women in low-income areas do not receive the same health care access as white women do. It could even be a racial bias in the doctor's office that affects how health care is delivered to them. But what does this have to do with social justice? There are many different point of views you can take. Not taking the time and care to attend to mothers post-birth can be seen as a form of misogyny. It can be an effect of a broken healthcare system and a lack of adequate access to it, or just simply a public health care disaster. When breaking down the statistics to race, it can be a form of even racism. All the topics add up to the overall idea that maternal mortality rate in the US is a social justice issue. Women who decide to get pregnant or don't even have much of a choice in the matter should have the right to adequate healthcare access to ensure post-birth survival, along with healthcare access to their children as well. There is a large focus on infant care prior to birth in the U.S. Researchers say that some doctors in residency can complete training in labor and delivery without ever stepping foot into a delivery room, leaving care for the mother in the background. As statistics are rising about the rate, more efforts have been made but may not be enough, such as the effort to establish a standardized protocol with uniform patient safety bundles. The bundles appropriately assess and address childbirth complications while addressing the unequal treatment in a uniform way. A problem arises with trying to implement the safety bundles, though. Not all hospitals may be able to afford these. With funding becoming a problem, it is reasonable to turn to the federal government, but very few things are being done on the federal level to address the problem. A bipartisan bill was proposed to Congress recently, named the Preventing Maternal Deaths Act of 2017, to improve healthcare quality for mothers, but was not passed in either the House or Senate. If lasting changes aren't made in the US, it's clear that the consequences will affect our society as a whole. In countries with comparable maternal mortality rates, there are clear economic and social consequences. More mothers will continue to die, especially Black mothers. There would be one less person in the household to help the family stay financially secure. The infant will likely die within a year of the mother. And should the child live past infancy, it will not receive the same care or quality of care in general to continue to stay ahead in school. Technology and science have come way too far for the US rates to be falling behind countries with similar statuses to ours. One way to combat this as an individual, the advice is for doctors, patients know their bodies, so best start listening to them well ahead of time to make sure they get adequate healthcare access. More diverse healthcare professionals are needed. So some experiences are limited to a race or ethnicity, so having someone similar to that patient may create a more comfortable environment for the patient to speak out about their health, or simply advocate and push for policies that provide funding or better access.